Welcome. Thanks for coming in to see us. How are you? I'm good. Thank you for asking. So I want to do the upper limb neurological examination today, based on the discussions that we had. But before we begin, I should just make sure you are who you say you are. So please confirm your name and date of birth for me. Perfect. And before we begin, are you experiencing any pain right now? Anything that I need to know about or be concerned about during the examination? All right. Well, great. So, there are a few segments to the exam. I'm gonna look at your arms just to see if there are any issues. We'll do some movements. I'll move your arms, I'll have you move them. We'll check for resistance and coordination, do some touching as well, just to make sure that there aren't any issues, okay? Does that sound all right? Okay, great. Then let's begin. So if you just want to keep your arms relaxed there, let me just have a quick look here. Okay, looks good. And that looks good as well. Okay, quick look around your face. And will you spread your fingers out and hold your arms out for me? Just making sure there's no visible tremor, anything like that. Okay, great. You can relax. That looks good. Now we're going to start with some movements. And for these first movements, I just want you to relax and let me move your arm. I'm gonna flex your wrist. I'm gonna bend your elbow. And we'll move the shoulder joint around. Rotation. Okay? Perfect. Okay, let's start with your right arm. Just keep it nice and relaxed and allow me to move the joints. Let's flex the wrist. And then I'm just going to bend that forearm up to your shoulder. There we go. I'm just going to rotate. Move that shoulder joint around. Excellent. And let's do the same on your left side now. Let's flex that wrist. And we'll take the forearm to the shoulder, bend that elbow. Perfect. And let's rotate that shoulder. There we go. Okay, you can relax now. Looks perfectly fine. For the next segment, what I want to do is actually do some movements against resistance. So I'll ask you to move your body in a certain way, and I'm just going to push back, apply some resistance, and we'll make sure there's just good strength in the musculature. Okay? So first off, I want you to bring your elbows up and touch your fists here in front of you. And I'm going to push down. I want you to keep me from pushing down, okay? Alright. And push down. And push down. Good, good. And now, bring your arms up like this. A little bit like a boxer. And I'm going to pull your arms towards me. I want you to keep me from pulling. Use those biceps. I'm going to pull and pull. Good. Same position, but this time I'm going to push. I want you to resist. Don't let me push your arms in towards your body, okay? I'm going to push and push, 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 push. All right, good. Now, I want you to go ahead and hold your hands straight out, and I'm going to push down on your hands, and just don't let me push them down. Okay, straight out here. I'm going to press down, and press, pushing down. Good. All right, you can let that hand go. Let's do your left hand. All right, just straight out here. I'm going to push down, push, 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 push. Perfect. All right. Now, go ahead and make an okay sign for me, and don't let me pull through, okay? And I'm going to pull, and don't let me pull through. Pull, pull. Great. Really good. Now, what I want you to do is just extend your hand with your fingers open, and I'm going to have my hand, and you're going to interlock your fingers with mine, and I just want you to squeeze the fingers together. Go ahead and squeeze my hand, okay? I'm going to put my hand out and put your fingers in between mine and just squeeze, squeeze, squeeze. Perfect. And let's do your other hand. So just place your fingers in mine and squeeze my fingers. Squeeze. Great. And now, I want you to just go ahead and grip my hands, grab hold of my fingers here, and just kung fu grip. Just crush them. Just go for it. Now, show me that power in those hands. Oh, agonizing. Perfect. Okay, you can relax. Very good. Good strength. The last test we're going to do here on this front, I'm just going to have you extend your hands, grip the paper with your fingers, and I'll try to pull it away, and you just hold on to it. You can start on the left, and just grip with your fingers. Perfect. And now we can do this side. And just grab it between the fingers there. And I'll pull. There we go. Very good. All right. Up next, I'll use my trusty hammer. We're just going to check your responses. So I'm going to do a tap on the outside of the wrist, the inside of the wrist, the forearm, and then outside the elbow. Okay? So just bring your arm in front of you here and just go nice and relaxed. I'm going to hit my fingers on your wrist here. Perfect. Let's flip the wrist over. Same thing on the inside of the wrist. Perfect. And go ahead and just stay nice and relaxed. And do on the forearm here. Good. And last one. And this one I'm actually going to lift your arm. Let me hold your arm up. Go nice and limp. We'll do the outside of the elbow, okay? Let me just... I've got it. And excellent. You can relax that side. And we'll do the same on the other side. So just bring the arm in front of you here. Nice and relaxed. And flip over to the inside of the wrist. Very nice. And let's just get the forearm then. Super relaxed. Excellent. And then I'll take the arm again. Get your elbow here. Nice and relaxed. Perfect. All right. You know, it's kind of weird to tell someone to relax when you're about to hit them with a hammer, but all of your responses there are perfectly normal. Everything is looking good so far. Now we're going to test your sense of touch and sensation. So let me grab my tool. Alright, to begin with, I'm just going to use this blunt tool, and I'm going to touch parts of your hand, just looking that you feel the sensation, and we'll work up the arm. And when you feel me touch you with the tool, just go ahead and say yes, so I know you felt it. Alright? So go ahead and close your eyes for me. Okay. 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 All right. All right. Okay. Oh, good. And let's do the other arm now. So keep those eyes closed. Okay. All right. Good. Okay. 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 Good. All right. All right. Good. Okay. Okay. Excellent. Now, I'm going to do a very similar test. Just using a piece of soft tissue here. And same thing, just let me know when you feel a sensation. Okay? 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 Alright? 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 Okay? Alright? Okay? Okay? Alright? Okay, good. Let's do the other side. Okay? Alright. Good. 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 Okay. Good. Okay. Okay. Alright. Good. Good. Okay. Great. Perfect. And was there any sensation difference between the two sides? No? Okay. Great. Alright. Let me grab another implement. This time we have the tuning fork. Do you have perfect pitch? Do you know what note that is? Yeah, it's a C. I just want to go ahead and let you feel that vibration there on your chest. Okay. And I'm going to have you again close your eye and hold out your hands for me. I want you to just tell me when you feel something and what it is you feel, okay? Alright, so close those eyes. Very good. Very good. All right. Great. Perfect. Set that down. All right. Now, just to check coordination and how everything is working in concert, what I want you to do is just put out your finger to touch mine, and then bring your finger back to your nose and touch my finger. I'll have you do that. And I'll move my finger, and you just track the movement and touch your finger to mine. Okay? So go ahead and touch my finger and back to your nose. Touch my finger, back to your nose. Touch my finger, back to your nose. Okay? And go ahead and do that as quickly as you can. Touch my finger. And yeah, just as quickly as you can. And keep going. Great. Now, you can relax that hand. Let's do your other hand. So again, touch my finger, back to your nose. Touch my finger, back to your nose. Go ahead for me. And do it nice and quick, as quick as you can. There we go. There we go. Keep touching my finger. Going nice and quick. Perfect. Very good. Alright, the next movement I want you to do is it's a clap. But then I want you to rotate your hand between each clap. The goal here is to go quickly, just as quickly as you can. Okay, let's go ahead and we can start. Alright, yeah, just flip that hand over with each clap. There you go. And nice and quick. Great, perfect. And now let's do the other side. There we go. Nice quick movements. Brilliant. Okay, you can relax for a moment. Alright, now what I'm going to do is I'm going to take your fingers and, we'll say this is bent and this is straight. Straight, bent. And I'm going to put your finger in a position while your eyes are closed. And I just want you to tell me if that finger is straight or if it's bent. Does that make sense? Okay, so let me take this hand. And now that middle finger, is it bent or is it straight? Okay. And this finger, bent or straight? Perfect. You can set that hand down. Let's do the other side. Okay. Moving it, bent, straight, bent, straight. And this finger, straight or bent? Perfect. And this finger, straight or bent? Very good. Very good. All right. So, for my last part of the exam, I would normally have you tie your shoe. to demonstrate your finger dexterity for me. But I see that you're wearing Velcro, so that won't work as well. So I would just go ahead and grab this pen for me and put it in a writing position. And I'll take that back and grab it with your other hand and place that in a writing position. Perfect. We'll take that back. And then can you just go ahead and unscrew this water bottle for me? There you go. And you can close it back up again. And let's do it in the other hand. Just unscrew and close it up again. Alright, perfect. Well, that completes the upper limb neurological examination. I haven't found any issues of any sort, so everything looks really good. Well, I'm really glad you came in to have it all checked out, but you're in good shape. Yeah, any questions for me? Okay. Alright then, well that concludes our exam, and you can get out of here. Yeah, you can just see the receptionist for the paperwork. Again, good to see you, and let us know if there's anything else you need. Alright, have a good day.